Good afternoon to you all. Thank you for joining. Um, I want to talk today about our current approach to managing asbestos and beyond 2026 as well. So, specifically looking at the challenges we already face and those that we may face in the future, and how we could be best placed to try and address those and maybe even solve some of those problems. The duty to manage asbestos. It's been in effect since 2002 with the release of the Control of Asbestos at Work regulations when it was formally introduced in the UK. That means we've had 24 years now of the duty to manage. Also means we've had approximately 120 years of using asbestos in the UK with zero legal requirement for us to assess or manage the risks from asbestos in buildings. It demanded, under Regulation 4, that the duty holder be accountable for managing asbestos in non-domestic premises, and it still remains the duty to manage in non-domestic premises. It demanded that a suitable and sufficient assessment is required to ascertain, firstly, do you have any asbestos, or is it liable to be present in the buildings? So an initial assessment to undertake and to ascertain whether there is any asbestos or not. Crucially then, where asbestos was identified or presumed, the duty holder then must employ a plan to prevent exposure. Even though 2002 was the year that it was formally introduced, it remained mostly unchanged in the 2006 Control of Asbestos regulations and the current iteration of the regulations, CAR 2012. So we've now had at least 14 years since the latest iteration of the regulations. So what I want to explore is what has changed in these 14 years. How does that maybe impact on our approach to asbestos management? And then what we can do about that. There are things that we already have in existence that we could maybe employ, and maybe a different approach or mindset towards how we're currently managing. I titled it, Can We Still Manage Asbestos in Buildings? Absolutely. I'm certainly not going to be talking about we need to get rid of all the asbestos, but we do have some challenges, and certainly lifespan is something I'll talk about. So the duty to manage asbestos, there are two elements really that I want to focus on in this webinar and certainly explore. So the first is Regulation 4.9. The plan for managing asbestos must include adequate measures for the monitoring of the condition of any asbestos or substance containing or suspected of containing asbestos. And that we ensure that any asbestos or any presumed or likely substance is properly maintained or, where necessary, safely removed. So it's that adequate measures element, the continuous monitoring, and the maintaining or safely removing asbestos. Our visual only inspections that most of us currently do, the re-inspections, they are only visual. Are they still an adequate measure for monitoring materials that have been in place for many, many years? Could it be argued that some ACMs can no longer be properly maintained and should therefore already be planned for safe removal? And then Regulation 4.10. The duty holder must implore that the plan is reviewed and revised at regular intervals and without delay. And then that little one, if there's reason to suspect the plan is no longer valid. It's quite often the case that we have a plan in place and it's regimented every 6 months, every year, we review it. And it's just remembering that critical element. If there's reason to suspect it's no longer valid. Certain materials currently included on the plan may trigger an automatic revision if they're identified as being unable to be properly maintained. So I'm going to keep referring back to these two crucial parts of Regulation 4 as we go through, but I thought it probably beneficial to start by looking at what other countries do and how it's led to our current thought about lifespans. So in terms of elimination, essentially, in the Flanders region of Belgium, they already have an asbestos safe target. They have a phased approach to the elimination of those ACMs that are easily accessible and friable. So AIB in a building that is easy for someone to access, that would be triggered for elimination from the building. And they're also focusing on asbestos cement as well. So Flanders already have this target, this vision, strategy of how they're going to start eliminating the asbestos materials. In France, they currently have a mandatory at point of sale asbestos survey trigger. This has been quite controversial in it when it was introduced, for simple reasons. If you were selling a house and the government told you you had to have an asbestos survey carried out on it, and that survey returned results that actually there's quite a lot of asbestos in your building, the price of your property may drop. You may even lose a sale based on that information. So there was a bit of controversy at first, but what they've found in France is it's actually driving an elimination plan. Because if you have a building that you want to sell and it does have asbestos in it, it's in your interest to start eliminating those ACMs so that when it comes to the sale, you've got a building with a better rating. And then in Australia, there's the Victorian Asbestos Eradication Agency, not to be confused with the Victorian era, which I quite often do when I see this come up. This has been established to prioritize and phase out asbestos from government-owned buildings in Victoria. They're a very proactive organization, and they produce lots of documentation which is available on their website. And one of the parts of their documentation is a plan or a chart that they produced on the lifespan of asbestos materials. And this was used as part of the justification for why they eliminated asbestos from the government-owned buildings. And it's very interesting to look at. So produced by the VAEA in 2024, the lifespan of some of the materials in their government-owned buildings was produced in this document. You can see on the document the red, the orange, and the yellow banners. Apologies, I don't know what size your screen is, but I do have some arrows to come in and give you some indications in a second. The red is the minimum life expectancy of the material. The orange is the average life expectancy of the material, and then the yellow is the maximum. So rather than focus on anything else, let's just look at the maximum, because that's the extreme of the material's expected lifespan. On this chart, they've got many materials, but I want to focus on three, really. At the top is the asbestos cement flat sheeting. You've got dates along the top there. They start at 1920 when they think flat sheeting was introduced in Australia. And you can see that the maximum life expectancy is around 100 years, which would take us up to about 2020 on the chart. And then the line down the end from 2024 when it was produced is demonstrating that the very maximum life expectancy of that flat sheeting has already been exceeded. For the asbestos cement roof sheets, a much shorter maximum lifespan. They're exposed to the elements. It's likely that there's going to be quicker degradation. So the maximum life expectancy of the external roof sheeting is down as 50 years. And you can see just how far that line of 2024 is away from the maximum life expectancy of that material. And then at the bottom are the asbestos boards. High friable material, low density fiber boards, and again, maximum life expectancy of 50 years. So although this is Australian based, the materials in the UK can be expected to have similar lifespans. A lot of our asbestos cement in the UK would be 70 plus years old. And if that's the case, is it still considered adequate to rely solely on the re-inspections of materials to assess their risk? How many cement roofs are still hosted on our registers as manage and inspect at regular intervals, when actually safe removal is probably the most appropriate action based on their lifespan? Are we effectively managing the risk if we're waiting for materials to show signs of degradation or damage before we consider safe removal? I'd argue a proactive approach would surely be more appropriate in regards to preventing exposures, especially with high friable materials such as the asbestos boards. So with those three in mind, I put an example together of asbestos cement and some of the challenges we're currently facing. On the left-hand side, asbestos cement as we typically view it. A relatively stable material, 10 to 15% asbestos content, very rigid, quite low fiber release, typically put on registers as a low priority item. But on the right-hand side would be asbestos cement that isn't in good condition and is probably nearing the end of its lifespan. you've got extensive moss or lichen growth on the cement itself, which can only occur because the roots of the moss or lichen can penetrate the cement itself, already signs that it is degrading, maybe past its lifespan. If you look at those two images then, one of the issues we face is that the photograph on the left may be the typical view that a consultant has when they come to our buildings to re-inspect the material, especially for roof sheets. It's likely on a re-inspection that we come into a building and we look up at the roof sheet, we see the view on the left-hand side, and the consultant thinks, yep, still in good condition, no problem. However, the photograph on the right-hand side may be the view if we could see it from above. And if the material assessment put in by the consultant is for the photograph on the left, but actually the cement looks like the photograph on the right, the risk assessment is unlikely to be accurate, a true reflection of the risk of that cement material. So already we've got signs of degradation that could cause an issue in terms of re-inspections, but the moss lichen growth can actually be extended out into a lot of a bigger problem. For example, if we look at the photograph on the left-hand side, when that moss or lichen gets dislodged from the roof, they pull the fibers off. So now we've got a situation where the moss is actually loose chrysotile. That's how we would record it. That's not just a bigger problem that the cement ever was, but we've now also got the problem of spreading the asbestos easily as well. It can be blown easily. Anyone chopping that grass is going to further disturb the fiber distribution, as well as being able to travel into buildings, such as the photograph on the right-hand side. This is a site where that moss contamination has not been addressed. It's been able to move around freely on site, and a lot of it, especially when it rains, would end up in the drains. So the building on the right-hand side, constructed after the year 2000, no asbestos issues, down on the register or on the management plan as post-2000 building. However, the drainage system is connected to older drains. It rains, severe rain floods up, it blocks the drain, backwashes onto site, and then when it dries, it leaves the asbestos contamination in the building. This building's unlikely to be managed properly, and certainly the asbestos issue that we found would have been not managed effectively, because that building is down on the register and on the plan as non-asbestos containing post-2000. So from a simple photograph on the left-hand side that we saw earlier, cement on a re-inspection, yep, no problem with that, leave it on the register, manage in situ. All of a sudden, we've got major problems. And I can see on the next set of photographs how it can also affect in terms of potential contamination. That building, and although you can't see it on the left-hand side, that has an asbestos cement roof sheet. The re-inspections found it to be in reasonable condition, low damage was the score. In 1 year between the re-inspections, however, extreme heavy rainfall in that area produced a situation where the building now has pure chrysotile dripping down the walls, the external walls, as you can see on the photograph on the right-hand side. So from ground level, building looks in good condition, and the roof was being managed. But you can see that the roof can't be in good condition because the rain is washing loose fibers off to such an extent that when the hopper overflows, it's dripping the chrysotile down the walls. So when it dries, that's how it appears, like the photograph on the right. Are we thinking about things correctly then? That roof has been present on that building since 1950, 70 plus years old. The lifespan must be exceeded. When we look at that regulation 4, bringing it back to that, can we effectively maintain a material that is past its lifespan and therefore should be expected to be degrading? Should the age of the material therefore trigger a review of our plan? Is our plan still relevant if we haven't considered that roof has been there for 70 years and this could happen? There's the argument that if it hadn't had that particularly heavy rainfall, if it hadn't overflowed, we still wouldn't have picked that up. We'd still be leaving that roof in situ and managing it. But we can see with what happened that clearly the guttering, the drain pipes, all of the drainage systems must be heavily contaminated as well. It is important to reference Regulation 16 at this point. We do have a duty to prevent, or as far as reasonably practicable, reduce the spread of asbestos. Can we consider compliance with Regulation 16 if we're allowing moss and lichen to just remain on the roofs, not managing it, allowing it to come off, blow around, not just our site, but potentially into others as well. So that's the materials lifespan and how that can affect it. But I want to move on as well to the actual the monitoring of the condition and how we currently approach it. We are looking at visual re-inspections for the vast majority of the time that we're considering leaving materials in buildings in situ, and then monitoring them by getting a consultant out at regular intervals to check on the condition. There is a legal precedent in the UK in regards to exposure to asbestos and the concentrations. In 2009, there was a High Court hearing. Diane Wilmore, who actually won the case, but unfortunately passed away before that the case was decided, won that court case based on the expert witness statement of mesothelioma can occur at low-level asbestos exposure, and there is no threshold dose of asbestos below which there is no risk. It's mentioned in the reporting of injuries, diseases, and dangerous occurrences regulations that a significant exposure to asbestos would be any exposure in a quantity sufficient to cause damage to human health. The difficulty we have is we cannot quantify that significant. It's why the legal precedent can be so important. A level above that which is commonly found in the air in buildings and the general outdoor environment. You need to establish what that is so that we can understand what the actual legal precedent is. The court found it appropriate to conclude each such exposure above the level commonly found in buildings materially increased the risk that she would develop mesothelioma. So when we consider adequate measures for monitoring ACMs, it's worth us understanding what the background concentration is and what can exceed that. And the simple answer to what can exceed it is anything. The accepted background concentration in the UK is typically taken from the 1999 DETR document on the asbestos materials in buildings and the airborne fiber concentrations. That document gives the approximate level of background fibers as 0.0005 fibers per milliliter. That's what we refer to as the background concentration. That level equates to around 500 fibers per meter squared of air. The current clearance indicator, which is 0.01 fibers per milliliter, is approximately 10,000 fibers per meter square, significantly higher than the expected background level. The clearance indicator is just the level below which a room can be legally occupied following licensed removal. The HSE stipulates it's not a safe level and should only be taken as a transient indicator, not an acceptable permanent level. So, are we effectively managing risk without sufficient assurance of the airborne fiber levels following removal, returning to background concentration? We typically have fallen into removing asbestos under licensed conditions and receiving paperwork that says everything was below the clearance indicator, 0.01. The HSG 248 itself says that fiber levels should return to background concentrations. I'd argue that not many of us are actually carrying out the background concentration level testing. Have we even ever established what our background concentration is for our buildings in comparison to what the accepted level is? I mean, it could be magnitudes lower. It could be around that. You know, we might already have reason to suspect that something is going on, but without that test, we wouldn't. So with the legal precedent being set as any exposure above 0.0005 fibers per milliliter, any lack of sufficient data may leave us vulnerable to future legal claims. Remember, any exposure above that, it could be cause for mesothelioma. How do we measure then to the background concentration? It's something that we already do. High volume air monitoring uses the same phase contrast microscopy equipment as any standard monitoring that you already have carried out. It's the same pumps, the same microscopes, the same personnel. It's adhered to the standards set out in the HSE guidance document, the HSG 248, as well as the ISO 17025 standard for UCAS accreditation. So there's nothing extra we have to do to allow anybody to carry out this type of monitoring. And it uses the same World Health Organization counting rules as the phase contrast microscopy. So again, there's no additional requirement. It's exactly as set out for the air monitoring we already do. And in addition to that, it's recommended that we carry out high volume sampling in the HSG 248 and in Syria guidance on asbestos contaminating soils. In a nutshell, if we increase the volume of air that we collect in the air sampling equipment, and then increase the amount of graticules that we count under a microscope, it is possible to calculate the limit of the detection down to the 0.005 fibers per milliliter, or the background concentration. So we're not reinventing the wheel. It's something that's already recommended, we can already carry out, but not many of us, I would argue, do. Is it a limitation of Regulation 4 that there is no legal requirement for air monitoring as part of our effective asbestos management? I've already touched upon the fact that re-inspections are typically visual only. If the materials have been identified as having any low levels of damage, for example, there is the potential for airborne fibers. Should we be undertaking air monitoring whenever the condition scores change? And if we are carrying out air monitoring because of that, should we be doing it down to the lower concentration or just reporting it to the clearance indicator? I'd argue with no regular air monitoring, how can we be assured that airborne fiber levels are at or below background concentration, especially when we are managing the more friable materials in a building? If the air test results that we're receiving are only to the clearance indicator, we haven't actually established whether exposures are above background or whether above background concentrations are still possible. Therefore, any ACM that is damaged, if we just run a snapshot pump of an hour, are we getting the full picture? And especially if we don't know what the original background concentration would have been before that incident anyway. Any damage to an ACM, by its nature, is also evidence that the management plan should be reviewed or revised. Something has gone wrong. What was it? The management plan needs to be reviewed to see if the control measures are still effective or if the risk assessment was undertaken accurately. How often is that taking place? And are we recording that we're doing that whenever there's a report of any damage? And although air monitoring is not a requirement of Regulation 4, it can be argued that to demonstrate that we are undertaking adequate monitoring regime, a base recording of fiber concentrations for a building managing ACMs would provide additional assurance that the initial risk assessment for the material was undertaken accurately and is still relevant. And then the last thing I really wanted to cover was the education on asbestos management and how that can really have an impact on effective management. Regulation 10, information, instruction, and training. In the approved code of practice for the regulations, the L143, paragraph 232 stipulates asbestos awareness training should be given to employees whose work could foreseeably disturb the fabric of a building and expose them to asbestos, or who supervise or influence the work. Asbestos awareness training can be face-to-face, can be an online module, it could be a face-to-face online delivery. The approved code of practice specifies the trades such as maintenance, refurbishment, and allied trades that should receive asbestos awareness training. I always find that difficult. The statement up there is quite clear. Why you'd specify, I don't know. I have met people over the years that have looked at the list of trades as an example in the ACOP and kind of said, well, we're not on there, we don't need it. I don't think you need to qualify beyond that statement. Anybody whose work could foreseeably disturb the fabric of the building or those who supervise or influence such work. And I find, although awareness training is often delivered in line with regulation, the depth of information within the courses can vary wildly. The approved code of practice gives a bit of detail on what should be covered within awareness training, but that detail within the elements that it covers, they can be interpreted differently, they can be delivered poorly, or they could lack any context in the training. I think it needs to be, it's something we need to address. Certainly, is an online module that just covers the generic asbestos awareness information relevant for ourselves? What ACMs do I have in my building? What do I need my staff to know? And I find online modules can often suffer from the lack of having somebody to ask questions of. If I don't fully understand some of the information, what is my avenue to actually get the answers? I think far too often we can pass online modules. We still have huge gaps in our knowledge. I sometimes see people doing the online health and safety modules that even we get handed out, and it's almost a race to click the mouse. How quickly can I get through this? Or it's a training module that's got a video on it and someone's playing it in the background, but they're actually looking over here doing their emails, knowing that when that finishes, they're going to have that the company's going to expect that, oh, well, they've passed that course. Should we be stress testing more often that people doing asbestos awareness courses actually understand the information they've been given? Can you tell me where the emergency procedure is held, or the steps involved in that? Can you effectively tell me how to manage the risks from asbestos that you've just been told on that course, for example? If somebody gets an asbestos awareness course and they get 8 out of 10, what were the 2 that got wrong? They could be critical for their role. Have I gone to them and asked them what 2 they got wrong, or do I have that already? So I can focus in on that, because that's clearly the gap. Or are we too often just accepting, do you have awareness? Yep, here's my certificate. Great. Okay, well, that's fine for me. That educational piece for those disturbing the fabric of the building can be critical to ensure that we do effectively manage the materials and they're not being damaged. And then furthermore, paragraph 225 of the approved code of practice stipulates that employers have a duty to ensure that the information, instruction, and training given to their employees is adequate to allow them to safeguard themselves and other employees to carry out their work with asbestos effectively. Lots of trades don't receive any detailed information on asbestos beyond a brief online module, sometimes a toolbox talk. Some may receive absolutely nothing at all. If a member of staff doesn't understand how to avoid the risks from asbestos, then they're unlikely to assist us in managing the asbestos effectively. Do they know that they should be promptly reporting damage to a known ACM? Do they even know what the ACMs are, what they look like? Lots of trades out there don't receive any more information other than the basic: asbestos exists, it's in the building, it's safe if you don't disturb it. That might be appropriate for a lot of organizations, but I think it's important that we, when it comes to training needs analysis, we do more in-depth look at that situation. Just off the top of my head, if a building has cleaners working in there, do they have the level of information to understand where the ACMs are? If damage to an ACM happens overnight and the cleaners are the first ones in the building, are they likely to vac it up, for example? And if they do, that might never get reported. It might be a long time before someone even notices there's damage, and by that time it's too late. So it's putting that extra emphasis on the education piece of how everybody else can assist in asbestos management. In conclusion, then, these ACMs have been present in our buildings for a minimum of 26 years. The ban on asbestos in November 1999 means that the youngest asbestos we have is 26 years old, or should be. So most of the asbestos has been present for many, many more years than 26. Leave-in situation is the default position for asbestos management. Although it's unlikely that that's going to change anytime soon, have we become too eager to leave asbestos alone rather than consider safe removal as part of a proactive approach to preventing potential exposures? It makes sense under Regulation 11 that our first thought is to not disturb asbestos to prevent exposure, and only when we need to that we remove it or do abatement on it, so that we've prevented as long as we can before we have to reduce. But it is strange that almost every other health and safety issue we have, that the control would start at elimination in the first place. So it's trying to amalgamate those two options. We will leave in situ as often as we can, but are we too eager to leave it? Should we be looking more at the elimination of the risk, the hazard in the first place? The lifespan of these materials is not infinite. We've seen a chart of some of them. Every material will have different lifespans, and materials in different locations and different environments are going to last longer or shorter than others. But we should take into consideration the lifespan of the ACMs when it comes to managing them. And certainly we need to get the consultancy side as well, considering that when it comes to the material assessment. We can't properly maintain ECMs if they've gone past their lifespan. So we should be looking at the safe removal of those materials. And certainly, like we saw with the cement roofs, if they're covered in moss, then they should be receiving material assessment scores for the condition that reflect the obvious degradation that we can see. An effective management plan should consider an elimination plan for aging materials and friable materials. Materials found to be or likely to be past their lifespan should trigger a review of the management plan to explore the option of removal. Friable materials will release significant quantities of asbestos fibers if disturbed. If they are in common areas that can often be found where it's reasonable to expect it can be disturbed without effective control, then the plan should be there to eliminate these rather than rely on annual or even less frequent than annual re-inspections of the materials. Should we be considering regular air monitoring for our buildings and monitoring airborne fibers to the background concentration? Air monitoring can provide us assurance that the materials we leave in the buildings aren't releasing fibers. Without air monitoring, we cannot know for certain that materials are being effectively monitored, even more so with the friable materials. And certainly measuring to background concentration would give us an initial starting point to understand this is our building's background concentration, so that we can refer back to that upon any incident or removal work that we have undertaken. And then the consideration of the asbestos education for all employees, including information specific to the ACMs in their workplaces. The more accurate information that our employees have on how to avoid the risks from asbestos, the better prepared we are to effectively manage our ACMs through promoting a safety positive culture. Thank you very much for listening. I'm happy to answer any questions anyone might have.